So last week we spoke about returning back to harmony whenever there is a problem or some kind of disturbance in our health. And we also spoke how body tries to communicate with us long before the actual disease appears. So before the fever appears, you will see this laziness, lacrimation, yawning, heaviness, mental fatigue. And similarly, for all the diseases, we have seen the premonitory symptoms, which are like precursors, and the body tries to warn us that this particular disease might come if you don't change your pattern, if you don't change your food, if you don't change your lifestyle. So once we get that indication from the body, with simple home remedies, which we have discussed the previous week, not previous week, the before week. So they are more like the headings are visible on my screen, like is the Zoom thing is covering the headings, Rakshit ji?
Yes, Bhaiya, headings are not seen, I think.
Not visible, huh? Okay.
Yes.
Because of this, yeah.
Maybe we are do one thing, kindly once stop sharing and then share again. Maybe it
Okay.
works.
But Bhaiya, the PPT is visible, and even loss of appetite as a heading is visible. Otherwise, if there is any other
Yeah,
header,
there is other heading.
okay, that is not visible, Bhaiya.
Yes, kindly.
I'm actually in a different setup. That's why I'm not in my usual this thing. Yeah, I think it is like this only. So anyway, so we have seen all these home remedies, how we can use the spices which are present in our house, fruits and vegetables and leaves in and around our house, how we can use them to solve simple differences, disturbances in the health. This is all we have seen, we have understood. And so now that we know what to do as far as home remedies is concerned, and even if home remedies are given but still health is not right, and if you feel that you need expert care, then you should also know when to visit the doctor, in which condition. These are a few slides which I think will be helpful to you. Heading is reading when to visit an expert, actually. And food and lifestyle corrections along with home remedies are followed, and if still the problem persists, then one should visit a doctor. And um, below points will describe when to meet a doctor. When the intensity of the disease is severe or the symptoms they go on increasing even after initial care, one must immediately consult a physician. Any problem when it is not subsiding even after 3 days of initial care needs an expert care. And the problem is recurring again and again, then also you need to consult an expert. Even if the symptoms have subsided, but overall condition is not as active as previous, then also you might need an expert care. If there is any adverse reaction of any medicine, or like you are regularly using some medicine, but suddenly there is an adverse reaction because of that medicine, then immediately you need to consult a doctor. If you have common cold, and along with the common cold you are experiencing these symptoms like painful swallowing, it's not just sore throat or dry throat. While you are swallowing, there is a severe pain in the throat, or along with cold you have earache and a cough that lasts more than 2 or 3 weeks persistently, and persistent or severe vomiting, a fever that doesn't go down or go away, symptoms that last more than 10 days or they get worse instead of getting better, All these indicate that you need an expert advice, expert care, even if it is common cold, if the symptoms are not getting better and if there are other symptoms like earache and painful throat, swallowing and all things. Loose motions, diarrhea. Occasional diarrhea is not uncommon and often it is harmless and it doesn't mean something is wrong. Sometimes excess toxins get accumulated inside our stomach, inside our intestines, and body tries to send them away, send them out of the body, and it happens through loose motions. But if this diarrhea is lasting more than 3 days and the stools are black and tarry, and if you find blood in your stool, and if there is severe abdominal pain, and because of these loose motions, there are signs of dehydration, dry mouth or dry skin, fatigue, and the urine output is very less. There is confusion, irritability, and whenever you eat or drink something, immediately you're having instant loose motions, and nothing is staying in your body, and you're getting dehydrated continuously. Then it is a time you need to visit an expert. Otherwise, body's effort to get rid of some toxins from the body through loose motions is a good thing. And if it happens for half day or 1 day and after that you become normal, then it is absolutely fine. Only if it persists more than 3 days, then you need to visit a doctor. And headache. We all get headache once in a while. They usually go away with rest or with some home remedies. But headache can also be a sign of a serious condition, such as a stroke. Sometimes there is some hemorrhage in the brain, or some clots or thrombus in the brain. That can cause headache, or some infection in the brain, so in the cerebrospinal fluid. Some meningitis is the reason for headache. Then also it is a dangerous condition. And if there is high fever, stiff neck, confusion, trouble in speaking or walking, and along with that you have headache. Headache is there, but along with headache you have other symptoms like the above. Then immediately doctor must be consulted. If any of the following symptoms are present, like headaches that are different than normal, like you are getting the headache more often or more severe headache that gets worse and doesn't get better even after taking some over-the-counter medicines, headaches that keep you from working, sleeping, and participating in activities, it is completely disturbing your lifestyle, then you need to consult a doctor. Normally, for simple headaches, simple rest is enough. Sometimes lack of sleep also causes headache. Sometimes we give this nasal installation called nasya, warm till oil drops in the nostrils. That also will help in reducing the headache. It's nice head massage and steam also will reduce headache. And of course we recommend this simple lap called sunti lap. You have the dry ginger powder. You mix half spoon of dry ginger powder in half cup of milk and boil it well and make a paste out of it and put the hot paste on your forehead. That should relieve the headache. These are all simple remedies for headache. And if it is just because of some excessive stress or strain, or lack of sleep, or reduced blood circulation because of stress, all these things will be relieved if it is not because of some underlying bigger reason. And normally simple rest and doing deep breathing itself will reduce the headache. And if it is not getting better, then you need to visit a doctor, particularly along with the headache. If you have fever, stiff neck, confusion, trouble in speaking, trouble in walking, all these things might indicate some kind of problem in the brain. And one common reason for headache is neck pain, cervical spondylosis, that causes headache very severely. And many people think that there is some problem in the brain, they get brain scans and all. But the problem is in the neck. And the nerves which are coming out of the neck and going into the head, into the eye and other places in the head, they get compressed because of some cervical spondylosis. A disc gets degenerated, it comes out of its place and it compresses the spinal cord. Along with it, it compresses the nerves which go into the brain, in the head region. They cause severe headache. So we also need to understand what is the reason behind the headache, whether it is a simple headache because of lack of blood circulation of the brain and lack of rest or lack of sleep or because of strain, or it is because of some underlying cause. Once we understand the reason, we will be able to easily solve the problem. And some digestive issues like upper digestive tract, where you get regurgitation, burning, difficulty in swallowing. Upper digestive tract includes esophagus and stomach, and lower digestive tract includes intestines, small intestines and large intestines. If you experience any of the following, like feeling like food is caught in the throat or chest, heartburn, acidity that doesn't go away and it gets worse or doesn't get better with medicine, difficult or painful swallowing, hoarseness or sore throat that doesn't go away, nausea, which is vomiting sensation that doesn't go away, sometimes vomiting blood or sometimes vomiting bile, green in color, very, very bitter in taste, severe or persistent abdominal pain, constipation, which means like completely no bowel movement, or diarrhea, which is continuous, doesn't go away, and stools that are very black in color or bloody, with blood in them or in red in color. All these things indicate that there is some underlying severe problem which needs to be addressed by a doctor, and they might not be cured with home remedies or some simple diet corrections. These are the symptoms which are like alarm bells where you should immediately go and consult a doctor. Skin problems are normally chronic in condition, but sometimes many of the skin problems can be corrected with simple home remedies, but sometimes we need expert doctor's advice. Like if there is a bleeding from the lesion, bleeding from the affected area, pus discharge, numbness in the area where there is a skin patch, whether it is hyperpigmentation or hypopigmentation, the skin becomes pale or skin becomes dark, and that when you touch the place, there is numbness, discolored patches, and sometimes non-healing ulcers. A small cut or wound grows to become an ulcer and it doesn't get healed, then it is a very big concern. And sometimes excessive itching in a particular place on the skin, foul smell from some lesions or some ulcers, and recurrent lesions, recurrent ulcers, and skin problem which is associated with any other problem or disease. All these things indicate that we have to consult a doctor. Suddenly, if the skin becomes too warm or too cold, too oily or too dry, too dark or too pale, all are indications of some disturbance, not just in the skin. Sometimes they might indicate some internal troubles also. In kids, if there is worm infestation, lots and lots of worms are there in the intestines, they appear as white patches on the skin, particularly on the face. Even nutrition deficiency causes these white patches. But sometimes the same white patches can be due to autoimmunity. If our immune system is getting affected and getting disturbed, and the immune system attacks our own skin. Immune system can attack any system, any organ system. But if it attacks the skin, sometimes it attacks the mechanism of production of melanin. Melanin is the pigment which protects us from harmful rays, so UV rays and other harmful rays. It protects our skin and it gives color to the skin. And when this melanin production gets affected, because our immune cells, which are supposed to protect us from external bacterial or viral invasions, instead of attacking those microorganisms, our own immune cells, they attack our own skin, particularly the melanin production. Then the particular skin part becomes pale in color, white in color, completely pale in color, and we call that vitiligo or leukoderma. So that is autoimmunity. So that is autoimmunity, and so it's white patch on the skin may not be because of nutritional deficiency in kids. It can be because of autoimmunity, and we have seen many kids with these white patches, leukoderma or vitiligo. So there definitely a doctor's intervention is very, very important. And a similar problem where the immunity attacks the skin cell division. Normally skin cells, they live for 30 days, and after 30 days they die and new cells, they get produced, they take birth. But sometimes because of the attack of immune cells on the skin cell division, this division becomes much faster. Normally a healthy cell, it grows, and after complete proliferation, complete growth, then they divide into two cells. Unfortunately, without proper growth in one cell, it divides into two cells, they become 10 cells, 10 cells become 100 cells, 100 cells, they become 1000 cells, and they divide too fast, and then the skin peels off, causes a lot of irritation and itching, and we call it as psoriasis, this peeling of our skin. And this looks so bad. Though there is no infection, no bacteria, no fungus, no virus, skin looks very ugly. And though the skin is looking ugly and it is a concern, the bigger concern is the immune system which got disturbed, and it is attacking our own skin. And it might sometimes, after attacking the skin, in the psoriasis patients, the same immune system, it attacks the joints. Then it becomes psoriatic arthritis. So all these are bigger concerns which need a proper medical care. And conditions like psoriasis and vitiligo, unless and until we correct the immune system and modify the immune system in such a way that it will not attack the body and it will do its own duty, which is protecting the body from external invasions. Until and unless that happens, these problems will not go away. Sometimes people take steroids, immunosuppressant drugs, which will cause temporary relief from these problems. But these steroids, which suppress the immune system, might cause other diseases in other organs. These are the side effects of using long-term usage of steroids. So it is very important for us to understand why this autoimmunity is happening, and with proper guidance of a doctor, we need to come out of this autoimmunity and correct our immunity. And again, for all these disturbances, along with the therapy, we need to understand that it is very important for us to eat good food in time, sleep in time, get up in time, do some physical activity, expose our body to sunlight, keep our mind cool and calm, relaxed, without anger, irritation, fear, and other mental stress. So all these things will definitely disturb the immune system, and the immune system might attack the skin or any other organ. Actually, there are 100 plus autoimmune disorders where the immunity attacks each and every organ of the body, and it will cause some or other kind of problem in the body. So it is very important for us to understand why these problems are resulting and what we have to do and when to consult a doctor. It is very important. And some dental problems where there is a big dental cavity, there are continuous bleeding gums, excess toothache, non-healing mouth ulcers or recurrence of mouth ulcers. These mouth ulcers, they are indication of some disturbance in the digestive system. It's not just the problem is in the oral cavity itself. When there is a severe digestive trouble, some kind of severe acidity and other ulcerations inside the stomach, the same things, they also appear in the mouth. So we should not just neglect that it's something related to oral cavity. It is affecting our digestive system. So we need to take the expert's opinion regarding why these mouth ulcers are recurring and non-healing. Excessive dryness of the mouth, discoloration of the tongue, all these things indicate some deeper problem, and body is trying to convey us in the form of discoloration in the tongue or dryness in the mouth and other symptoms which body is trying to convey a deeper trouble. Maybe we are not competent enough to understand what is the trouble actually. So we need to consult an expert, and he will guide us how to get rid of the actual root cause, thereby removing the symptoms, relieving the symptoms of the oral cavity. Similarly, if there is excessive lacrimation, lots and lots of tears are getting produced, and there is redness of the eye, and the vision is getting blurred, non-healing lesions are happening inside the eyes, and there is difficulty in reading from normal distance, then you need to consult a doctor. Sometimes, particularly if there are some comorbidities like diabetes is there, and eye is becoming red, and there is blurred vision, maybe because of the diabetes, some kind of retinopathy is happening, some kind of hemorrhage is happening inside the eyes. I have seen many patients where excessive hemorrhage, bleeding happens inside the eye, and that causes blurred vision. And the reason behind this bleeding inside the eye is diabetes. Because of chronic diabetes which is not in control, it will cause several problems in several parts of the body, and one such problem is the eye. So diabetics with eye problems face so many difficulties in solving their problems because particularly in modern system of medicine, these troubles are very tough to handle. Luckily in Ayurveda we have got some really good therapies to solve this problem, not only the problem in the eye but also the diabetes. There are so many people who have stopped using insulin and tablets after using them for continuously for 20 years, just by correcting the lifestyle, just by correcting the food, just by using some simple medicines. People are getting rid of these all medicines which might not prevent the side effects. They might keep blood sugar levels down, but they may not be able to protect our body from side effects of diabetes like degeneration in the nervous system, neuropathy, degeneration in the kidneys, nephropathy, degeneration in the eye, retinopathy, and so many other organs get affected. So it is very important for us to keep an eye on our own eye if we have this comorbidity called diabetes. As far as the weight is concerned, if a person is underweight and the body mass index is below 16, then it is a concern. And the weight loss, if it is because of any particular disease, and along with the weight loss, there are complications like weakness, loss of appetite, etc., then that should be a big concern, and immediately we need to go and consult a doctor. Similarly, if the weight is increasing like anything, and the BMI is above 30, and this obesity is because of some other disease like thyroid or diabetes or any other bigger lifestyle problem, which is causing accumulation of fat inside the body, not allowing the micronutrients to reach various organs. Each and every organ needs continuous nutrition for rebuilding itself. Tissue building and energy production are the functions of each and every cell of the body. and each and every cell needs micronutrients. But if these nutrients are not reaching the body and they are getting converted, maximum amount of nutrition is getting converted into fat and it is getting accumulated inside the body. And there are complications like breathlessness, fast heartbeat. Then it is a bigger concern. And you need to consult a doctor, correct your lifestyle, eat good food, do some physical activity. Physical activity is the lack of physical activity is the biggest culprit and fourth largest cause of mortality, fourth largest cause of deaths. And it is very important for us to stay active. You know, we all know that bats are the ones who have taken this coronavirus and infected human beings. You know, in China, some people have eaten bats, and some people have destroyed the places where bats used to stay. And these bats, unfortunately, they came into the places where human beings dwell, and they have transmitted this coronavirus to human beings. But an interesting fact tells us that bats never got affected with coronavirus. Even though they are carriers of this coronavirus, they never got affected by coronavirus because the internal atmosphere, internal environment of the bat's body is not conducive for the virus to replicate and to spread all over the body, because bats are the only mammals which can fly, and they fly a lot, and they spend so much energy, they create so much heat inside the body that it is simply impossible for the virus to replicate or to convert into new mutant and attack the bat's body. That is the reason why no bat gets affected. Similarly, people who are very active, their lymph circulation is very, very active. Lymph is the fluid which carries all the white blood cells which are able to kill these viruses and bacteria from the lymph nodes to the area where this fight is happening between the bacteria and the body or virus in the body. And this for this lymph circulation to happen, there is no heart which can pump this fluid called lymph. So it happens passively. But people who are physically active, their lymph circulation is much, much better than people who are inactive and sedentary. So for those people who are physically active, their lymph circulation is very good and their immunity is wonderful. And they are the people who will not get affected by severe infections because their lymph circulation is wonderful. So it is very important for us to stay active and avoid problems like obesity and heart troubles. But if the obesity is increasing continuously and there are symptoms like breathlessness, fast heartbeat, tachycardia, etc., then you need to consult a doctor and understand the underlying disease which is causing the obesity, whether it is thyroid or any other problem or any other hormonal imbalance which is causing this obesity. We need to understand, then we will be able to come out of this obesity. Similarly, anemia. If the hemoglobin level is below 9 grams and there is breathlessness, there is weakness, there is swelling in lower limbs and digestive system becomes very weak. All these conditions indicate that there is some severe problem inside of the body, and we should not neglect. Skin becomes very pale and body becomes very weak, and sometimes headache and other digestive troubles will come. So that is a time when you need to immediately consult a doctor. And if the hemoglobin level is much below 6 or something like that, you might also need blood transfusion. So similarly, there is back pain, and most back pains will go away in few weeks without treatment. And of course, it often gets better by using some home remedies and rest, doing some simple asanas like Bhujangasana, Shalabhasana, Dhanurasana. All these things will bring down the back pain. Applying hot fomentation to the area that hurts often helps, because in that area where there is pain, there is severe muscle contraction. Muscle becomes spasmodic and it contracts and it will not relax properly. So when you apply some hot fermentation that increases the blood circulation to the muscle, and slowly the muscles, they get relaxed and the pain gets relieved. But if the problem is persisting, it can be a sign of a bigger problem, and doctor's consultation is necessary. If there is constant pain, if the pain which you are feeling is spreading down one or both the legs, it's not just in the lower back region on the muscle where there might be a sprain, but the pain is spreading to the legs, even to the fingers, past your knee, it is going below and until your fingers, the pain is radiating. Then it is not just a muscle spasm, it might be a compression of the nerve which is exiting the lower back and entering the thigh, and it is going till the fingers of the leg. So that is the condition where you need to rush to the doctor and immediately take the consultation. Pain with weakness, numbness, or tingling in one or both legs also needs attention. Sometimes the back pain, it radiates from the back to the front, particularly to the groin region and loin region. That kind of back pain can be because of kidney stones, and sometimes they got stuck in the ureter or urethra, which cause severe back pain. So immediately you need to go and take consultation from the doctor. Sometimes back pain is there, and also weight loss is there, where there is no explanation also. Pain with swelling or redness in your back is also a bigger concern. Pain with fever can also be a concern. So if the back pain is not getting relieved with some simple home remedies, some bed rest for at least some 3 hours, if it is not relieving, even the hot fermentation oil application is also not helping, then you need to consult a doctor. And sometimes head injury happens, even a small bump, suddenly you fall and your head hits a wall. That can be dangerous if there is a bigger problem inside the brain. So you need to understand what is the condition where you need to rush immediately to a doctor. Because of the concussion, like these are the signs of concussion, where there is some damage inside the brain. There are some symptoms like dizziness, and there is a problem in balance. You are not able to walk straight. You are not even able to stand by yourself. And there is this, immediately after hitting your head, after the head injury, there is this nausea and vomiting sensation, or actual vomiting. And there is confusion. You don't know where you are. You forget many things. Or sometimes even for a few moments you are unconscious. And there are problems with concentration and memory. And there is a feeling of sluggishness, and brain is foggy. And suddenly, if someone switches on the light or someone makes a noise, you are highly sensitive to the light and noise. And there are sleep problems, mood changes, all these things which appear after a head injury demands a doctor's consultation. There are some other symptoms in the picture also. Delayed response to the questions, ringing in the ears, seeing stars continuously after head injury. Amnesia surrounding the traumatic event, means you forgot how this event happened, how you hit your head with something, bumped your head. If you don't remember, then there is a problem in the brain, and you need to rush to a doctor. And normally, many women, they experience trouble during the menstrual cycle, severe pain and excessive bleeding or white discharge or something like that. And if suddenly periods become irregular, no periods no menstrual cycle for 3 months or more, and between periods there is bleeding, a period that lasts much longer than usual 3 to 5 days, and much heavier, and lots of bleeding is happening, and there are severe disabling cramps. Normally, some people experience cramps, but if they are very severe, then you need to go and consult a doctor. Other symptoms mentioned here are mood changes, breast pain, low back pain, abdominal pain, headache, acne, increased appetite. All these things, along with hair fall, dark color of skin, mood swings, all these things might indicate some kind of hormonal imbalance, some development of cysts in the ovaries. Then you need expert doctor's consultation. And mental health is also very important, and we should never ignore our mental health. Having issues with mental health is also very common and treatable. If there are symptoms like feelings of depression or sadness that doesn't go away, depression is common, and we have seen that some or other time we all feel depressed. But if this feeling of depression is not going away at all, even months together you are not feeling like meeting with other people or going out of the house or something like that, this feeling of depression is not going away, then you need to consult a doctor. And feeling extreme highs and extreme lows, sometimes it becomes bipolar disease also. Suddenly you become too excited, maniac like, and suddenly you become very depressed, and the difference is extreme. Then also doctor's consultation is very important. And having excessive fear, excessive worry, anxiety, withdrawing from social interactions, changes in eating or sleeping habits, inability to cope with daily problems, even small challenges also, if one person is unable to face them and running away from these challenges, going back into their own shell and experiencing delusions, hallucinations, and feeling like getting addicted to some kind of toxic things like alcohol or smoking or drugs or any other things, substance abuse, thoughts of hurting others or hurting themselves, all these things need some expert supervision and lots of counseling. And of course, a lot of help from the family members is very important, especially when a person is experiencing troubles in mental health. And of course, there are other symptoms like, we can't categorize them, but very important symptoms like dizziness, feeling like you're going to faint, shortness of breath, heart palpitations, unexplained weight loss, fatigue that doesn't go away, severe sweating, especially cold sweats, swelling in the ankles, swelling in the legs, a rash along with the fever which is higher than 100.4, and suddenly a particular part on the skin or a mole, it changes suddenly and increases in size. All these things need experts at consultation. So the thumb rules about when to visit a doctor or health expert are like this. When the intensity of the disease is severe or the symptoms, they go on increasing, even after initial care, then one must immediately consult a physician. Any problem which is not subsiding even after 3 days of initial care, and when the problem is recurring again and again, when the symptoms are subsided, but still we are not as active as previous, even after recovery. 3 months back, someone gets recovered from COVID, still the person is not active, then there is a concern. Maybe you need to consult a psychologist, or some other underlying cause is still troubling. And of course, if there are any adverse reactions of any medicines, these are the times when you need to consult a doctor immediately. So that is a time when you need to take a medicine. And you need to also understand there are various systems of medicine. There is this allopathy, then Ayurveda, then homeopathy, naturopathy, and then of course there is Siddha, Unani, Chiro practitioners, and what we call the acupuncture, acupressure, so many things. But we need to understand where this particular problem will be solved effectively. For example, as I told you, the vitiligo and white patches, we have seen excellent cure in Unani medicine. In Hyderabad, there is a Unani Research Institute. They give some very, very affordable medicines which are very, very effective in treating this vitiligo, skin white patches. Much more effective than Ayurveda. That's what I have seen. Gastric troubles, acidity, and other things, they are much effective in homeopathy. That is my experience. And chronic troubles like severe degeneration in various joints or various organs, I have seen excellent improvement in Ayurveda. And there are some places where even allopathy doctors, they prescribe Ayurveda medicines. Like if there is jaundice, liver troubles, all the medicines prescribed by even modern doctors, allopathy doctors, are Ayurveda medicines. Like you might have heard about leaf 52 years, Amli Cure years. All these are Ayurveda medicines prescribed by even modern doctors. There are some diseases where Ayurveda works wonders, and that too very fast. Anorectal diseases where there is excessive bleeding from the rectum, and in spite of continuous surgeries for hemorrhoids, piles, or fistula, the problem is recurring. We have seen wonders happening with simple medicines in Ayurveda. But there are some areas where you need the expertise of an allopathy doctor. If there is a heart trouble which is acute, or some accidents, or some sudden problems like appendicitis, or sudden intestinal perforation, there is a hole in the intestine happens. These are all what we call emergency situations where you need to get operated. These are the things where you should never compromise. Of course, there are troubles like if you have a kidney stone and the pain will be severe. One cannot explain the kind of pain people experience when the stone gets stuck in the ureter. But for such conditions, instead of going for surgeries, even if laser surgeries, if you use Ayurveda medicines for even one day, the pain comes down, and within 10 days to 30 days, stones, they get dissolved and they come out of through the urine. And we have seen miracles happening, particularly in gallbladder stones, where there is no other way except to remove the gallbladder. There we have seen Ayurveda medicines working wonderfully. So there are many areas in each different system. Some diseases, they get cured so fast without any recurrence. So we need to have a holistic system. This is where government's intervention is very important. We should bring all these doctors under one umbrella and let them understand the strengths and weaknesses of each system. And once there is a communication happening between these doctors, they will be able to give a holistic approach. Recently, we have started this Arogya Raksha Kavach for patients who are suffering with COVID, whether they are getting treated in the home quarantine, or post-COVID patients with so many side effects. Luckily, 30 doctors from America, they became a group and they joined hands with us, and we in our city, we have treated so many people with so many complications, continuously monitored by doctors who are staying in America. They gave 3 hours per day for us. They have sent 75 oxygen concentrators. They have appointed nurses to go and do home visits. and Ayurveda doctors to suggest Ayurveda medicines, yoga professionals to suggest breathing exercises and pranayams and asanas, and physiotherapists to suggest lung exercises, and counselors, psychiatrists, and psychologists to counsel the patients. And with the collective effort of all these experts, we have seen miracles happening. Even patients who were advised lung transplant got recovered very fast with this kind of holistic approach. And that is the future, I think, where all the systems, they take the a thing of helping the patient as the ultimate thing, and not recognition of which system is better and which system is not good. So taking all the strengths and weaknesses into consideration and helping the patient from all the directions, holistic approach, that is the need of the hour. So I think I can take some questions. Ranganaji, yes.
Sir, I have no question, sir, but I would like to express my profound thanks, sir, for guiding us to get rid of shoulder pain, cervical pain, sir. Sitting for a long time in front of the computer and sitting there.
Yes.
I followed your suggestion, sir. I now feel very comfortable, sir.
Great. Great.
Thank you. Thank you very much. I am spreading to my students also do like this, because nowadays we used to sit in front of computer operating.
Yes.
And other things, sir. Really great, sir. I have one more request, sir. Can I ask you, sir?
Yeah, please go ahead.
Sir, I have iron deficiency, sir. Recently, I went for complete body checkup.
Yes.
Everything okay, but iron deficiency is there, sir.
Okay.
How to improve it, sir? Sir, any home remedies, sir? Kindly suggest me, sir.
Yeah. Actually, again, iron deficiency can be because of many conditions. But if the nutrients are not reaching the all the cells properly, and
Yes.
body is unable to prepare hemoglobin, body is unable to prepare more blood cells,
Yes, sir.
can be iron
Yeah.
deficiency. And we strongly advise intake of ragi. Ragi is rich in iron.
Yeah.
And then there's bajra.
Yes. Sir.
Bajra is very good in increasing the blood count.
Yeah.
You
Sir.
know bajra, right? So
But, sir,
then,
I used to take gongora, sir. Gongora, sir.
gongora is good. Then curry leaves are also good. Karvepaku.
Yes.
Then this what we call they say that banana increases hemoglobin.
Yeah, sir.
Banana.
But I am a little bit diabetic, sir. I stopped.
For diabetics, it is not advisable. And of
Yes.
course, we have this what we call pomegranate,
Yes, sir.
dadim.
Good, sir. Thank
And
you.
I have a very good medicine
Sir.
which is which helps the body in making its own hemoglobin.
Sir.
It's not like you take iron capsules or something like that.
Sir.
So I have written this, in the chat window, Tapyadi Roham.
Yeah, I take. Sir. I
Helps
check.
the production of blood cells.
Yeah,
And
I check.
enhances the, increases the blood count. All you have to do is take 2 tablets twice a day after food. I
Yes.
find it very, very helpful.
Good, sir. Thank you, sir. I fall. But generally, I'm very active, sir. I teach for 4 hours, sometimes 3 hours continuously.
Yes.
But I don't feel any sort of weakness or things, sir. I'm quite right, sir. But this, again, I thank you very much, sir, for guiding us to get that muscle relaxant, sir, by doing some physical exercise. Again, I thank you very much, sir.
Great.
It's not only for me, sir, the entire the people who suffer this, especially the youth,
Yes.
who are they spend much time with these laptops and other things, bending their back. So I
It's very
thank you very
important
much.
to correct the posture regularly. It's very, very
Yes, sir. Yes, sir. That is, I told them, sir. I told them. I told my colleagues also. Sir.
great.
Thank you. Thank you. Thank you very much, sir. Okay, sir. Bye. Thank you.
Any other questions? Sorry, I'm not in my regular setup. That's why there are some problems. My mic is also not the regular mic I use. So, this chart, this is the because of this corona, we were unable to conduct this master training workshops, and we were unable to conduct physical workshops, holistic human health workshops. But of course, we did some online workshops in various colleges, and we did it in various colleges online. I prefer doing this offline. So let's hope this knowledge reaches all the engineering students as early as possible, maybe from the next academic year. If there are no questions, maybe we can. Yeah, Rekha ji, yes, you have a question? You can switch on your mic and unmute your mic and ask, madam, or you can type it here.
Sir, there was some question from YouTube. Sir, black small with itching. What can be the remedy for it?
Itching and
It will be madam posted. Black mole with the itching.
black spots with itching.
Yes.
See, as far as skin is
Black,
concerned,
black mole.
mole. Okay.
Yes.
Yeah, if the mole is increasing in size or suddenly severe itching or burning sensation is happening, then it is a reason of cause for concern, because maybe that mole got infected with some virus or something like that. So it is very important for us to go to a doctor and get a consultation. So maybe home remedies might not be effective, particularly when a mole is getting affected.
Okay, sir.
Yeah. Rekha ji, you don't have a mic. Now I think you have a mic. You can unmute yourself and ask the question.
Yeah.
Yes.
Like on my hand or sometimes on my cheek, only
Yes.
that much. A very small area only, but I get that itching and the skin also comes out. But it is only during the periods. Once the period is over, it gets cleaned up. And I have observed it is only during this. So I've consulted the skin specialist, the homeopathy doctors, even Ayurvedic doctors. I've even told them that this happens only during this particular time. So what they said is, and I have got it only after the birth of my second child. Before that also, I never had this trouble. So doctors told me it could be because of the weakness during this particular period, or the immune system is weak. So and now what to be done, because I've consulted even Ayurveda, homeopathy, even skin specialist. So Any?
I'll suggest you remedies first. One thing is take half spoon of turmeric powder,
Mm-hmm.
mix it with some 5 leaves of tulsi and 5 leaves of neem,
Neem. Okay.
and make a paste-like thing,
Hmm.
and then swallow it
Mm-hmm.
on empty stomach.
Okay. Morning.
Do it for at least 1 week, 2 days before periods and 2 days after,
Mm-hmm.
and do it for 3 months like that.
Okay.
So I have seen this working nicely for many patients. So turmeric powder, tulsi, and neem. Yes, I have
It is
seen.
there, no?
I
Yeah,
have
yeah.
seen
I
this.
was worried it's a special thing for I have facing it.
No. I have seen patients with similar problem.
Mm-hmm.
So that you can try.
Yeah.
And if that is not working, then maybe you can just I can help you with online consultation with who is a gynecologist, my wife.
Okay,
She might
okay.
help you.
Yeah.
Okay.
I even went to my gynecologist also.
Okay.
So there even they did. I don't know why it happened, but yeah, this is there. So once trouble.
Try this thing and tell me how it is.
Yeah, but then I should try only during this particular
Yes.
period. I'll do that.
And
Okay,
someone
doctor.
is asking remedy for warts. Warts are like skin tags which happen on any part of the body, and normally they will give a special medicine called Vatari Kukulu, which is wonderful in killing the virus and cutting the blood circulation to the warts. And warts, they fall away just by eating this tablet, 2 tablets twice a day after food. It's very effective. And of course, we do some therapies called Agni Karma, where we do some cauterization, or sometimes Kshara Sutra, some kind of medical tied to the wart to kill the blood circulation to the wart if it is big enough to tie and keep a knot. So yeah, warts they can be easily cured. I don't remember any home remedy, but with simple medicines we can solve the problem of warts. I think it is 5 minutes past. Parikshit Bhaiya.
Yes, Bhaiya, certainly. It's time also. So, thank you, Dr. Sundaraji, for this interactive and informative session. I hope we all have got benefited as always. Isn't it, Manisha Didi?